go ahead and go into a subcommittee so we can hear the senator's bill. And so Senator Crawford, whenever you're ready to begin.
Thank you, Mr. Chair. Thank you for letting me go first since I have another bill up in the House at the same time. You know how that goes this time of year.
Should we reconsider?
Well, I think maybe just let me go ahead would be great.
I'm game for that. Go ahead.
Thank you, Mr. Chairman, members of the committee. For the record, Sandy Crawford, District 28. Thank you for the opportunity to bring before you Senate Bill 566 today. So currently veterans who receive MOBUX loans from the state, or not the loan's not from the state, but the state funds the money to be able to get them a lower rate, also known as linked deposits. They're required to do a Boots to Business program, which is just a program that tells them how to run a business, which that's all well and good, and I think it's fine. But we make our veterans go through that program. Nobody else has to do it that gets a MOBUX loan, and I think we're unfairly treating our veterans, and this still allows them to do it if they want to, and my understanding is that they get to do it at no cost, but I don't think we should mandate them above all to do it when nobody else has to. So this just says that they may instead of they shall go through that program. I think it's common sense, and I do have a witness that can maybe go into some more details, but I'm happy to present this on behalf of the veterans today.
Thank you, Senator. I do have a question. As I was reading the bill, I was wondering, are there any reports or stats that show success or not success, and why was the change made overall?
You know, I think my witness that's going to come up can speak more to that, more specifically to that. He's more familiar with the background on why we did this in the first place. But like I said, my point is, why should we make our veterans do it when every other small business or no other small business owner has to do it?
Very good. Thank you. Any other questions from the committee? Seeing none, are there witnesses in support? Please come forward. A friendly face.
I know I have to fill out form. Mr. Chairman, members of the committee, I'm Harry Roberts. I'm the Missouri military advocate for the state of Missouri. I've been in this role since January 3rd of 2022, and then just a few days shortly the Senate confirmed me for this role. So glad to be here with you again today. I'm in support of this. My office is in the Department of Economic Development. That's where it's housed. And so our legislative liaison would have been here in support of this as well, but he had another meeting he had to attend. So I'm going to try to answer some of that and wrap that up nicely for you, Senators. So Boost to Business was passed and sponsored by Representative Dean Dorman a number of years ago. And of course, Dean was very interested in helping our veterans. And the whole idea was, hey, let's make sure there's funds available for veterans to start or assist with a small business, start a business, expand their small business through the Linked Deposit Program, which is administered by the State Treasurer's Office. So they wanted to make sure there would be funds just there available to veterans, and that's what came up with Boots to Business. When they did the language, and I talked to Representative Dorman, and we've lost him now, as you know, but I talked to him when this bill first, the issue on the shall and may came to light in 2022. And I said, listen, I know you're the sponsoring legislator on this, but I want to visit with you about that. And he had plenty of time. And I said, was your intent to require veterans to go through a mentorship program, or was it to require it be available to them? And he goes, the intent was to make sure it was available to them as a resource to them to help them succeed. But it was never intended that they'd have to be mandated to do that to participate in the Linked Deposit Program under the veteran portion of that. I said, okay. So we've come back and tried this a few times. It's been heard in the House. Unfortunately, it hadn't gotten over the line yet. But ultimately, what this will do is it still maintains that if you're a veteran and you check the box on that Linked Deposit Program that's administered to the State Treasurer's Office, then you will have made available to you this mentoringship program to help you and assist you. That's all it does. I'll be honest with you right now, the mentoringship program isn't even active because when we tried to get all the dots put together, I'm not required to, but I wanted to try to help get this program off the ground. Then State Treasurer Fitzpatrick would not sign the directive because he didn't want to see a barrier put in front of a veteran that wasn't put in front of any other citizen who was not a veteran. So he wouldn't sign it, and he goes, "I'll help you change it." And well, then he became auditor. So he's not here to help with this today, but that's the history of it, Mr. Chairman and Senator. That's the history of why we're changing this to a may instead of a shall.
So if I'm hearing you right, it sounds based on your testimony that there really hasn't been a track record established, but it really wasn't utilized.
Correct.
Very good. Okay. Any other questions for the witness? Seeing none, thank you for your testimony.
Thank you.
Any other witnesses in support? Any witnesses in opposition? Very good. Seeing none, Senator, any last comments?
I know how you like to cut red tape, and this would be a great way to do it, Senator. Thank you.
Show me the tape. We'll cut it. And I think I've seen it. Thank you, Senator. That closed the hearing on Senate Bill 566. Now, if only we can get a quorum, we can go into other business. We are making some contacts, so we will go into recess just. We do have another perhaps.
Nicole Jenkins. Am I in the way? Filming. Okay. Okay. I'm trying to go fast.
We have some other business that we can take care of while we're waiting on other members to show up. And Nicole Jenkins, would you mind to come up and share some information with us? Thank you for making the trip. We had an opportunity to meet a few weeks ago, I think, and grateful to you for coming back to give the committee an update. So, and is your microphone on? It should be a green button lit up.
Now you can hear me.
There you go. Very good.
Again, thank you for having both Army veteran Brianna Garza and I, who is an employee of Veterans Advantage Urgent Care, who started off as a patient. We are here today because Veterans Advantage Urgent Care started off as just a subspecialty urgent care for veterans to take a load off of the VA. We quickly identified in 2020 that there were more veterans walking through our doors that were non-eligible at the VA, that were unhoused, that were having mental breakdowns, and they really needed to be seen. In 2022, Veterans Advantage Urgent Care moved from its original location on Washington Avenue to the Grove to keep the mission going. We were shut down due to the crime in St. Louis. But during that shutdown, we were getting veterans who just started bogarting our doors. We expanded in the Grove, and we started a nonprofit side. And we had one in 21, but we never really used it. But we really had to start looking at the amount of veterans that we can serve, and also how we can help save the state of Missouri money, how we can help the VA, because the VA workers, Manchester Clinic, Washington Ave Clinic, they will call us. They were so overwhelmed. There are more veterans than there are facilities. And it broke our hearts to see veterans come in. They were living across the street in containers. They were sleeping in the fronts of City Hall. And I adapted the same model that I adapted on Washington, that no veteran is to be left behind and no veteran is to be turned away. I've been taking for-profit money, putting it on my nonprofit side. I've never received a quarter from the city of St. Louis. I've never received funding, and we need it. We need it severely to keep this mission going. We are not giving any opioids. We are servicing 6,000 plus veterans. Last year we serviced over 300 charity cases just on the healthcare side, not even the art programs, not even the peer-led group programs, not even the housing. Not only do we do the healthcare, we do clothing. We have a clothing closet. We have the art programs. We have exercise. We do yoga. We do a lot of things to keep them off of that suicide break. And we need some appropriation. If any senator, if anyone can find money for us to keep this program going, because we can't continue to take the for-profit side for the nonprofit. And it's very imperative. And I think veterans are due this. They're owed this. Brianna came in as a patient for back pain. She went to a big hospital. Her bill was $3,000, and they gave her opioids and nothing else. She came to us. She got acupuncture, chiropractic care for $300. So think about a veteran that's unhoused that's coming in for those problems. We're saving this state so much money, and we feel like we're due. We need something to help us.
May I interject a question?
Yes.
You're talking about the need for money, and I think I understand, but would you tell us, so that we fully understand, how will the money be used, what payments you're needing to make that
Okay.
maybe you're not be able to fully make at this time?
So our rent has increased. Our expenditures for providers have increased. Our veterans are coming in. I had to just add on another provider back in May of 2024. That has increased. So my payroll is up substantially because the quality of care that we're providing, one provider can't take 40 chiro patients. Mm-hmm. So one mental health social worker or therapist, they can't take 40 a day. And we're steady going up in numbers, but payroll is going up.
And based on the amount of payment for Brianna's treatment,
Mm-hmm.
you're obviously not paying top scale for that. And
Yes.
so that's a kudos to the providers who are accepting that as well. Have you a spreadsheet that has been put together that shows what your current income expenditures are, and so that we can make a presentation to the Appropriations Committee so that they can see what they need to see?
I can get that to you in 24 hours. We looked at our data on Monday, which we came up with our numbers. We're a little bit old school and a little bit new school. So we have all of that. We can get that to you in 24 hours.
Okay, if you can do that, that would be great.
Absolutely.
Let me ask if there's other questions.
Okay.
Any questions? Okay, all right. What else do we need to know? You've given us, in our conversation, I remember some of the things that you were talking about, and I think it's intriguing that you are making that available, and I commend you for it. So.
Okay. So we also have become great community partners with a lot of companies in St. Louis City and County to help better serve our patients and expedite care.
And tell me what that looks like.
So when you go to your chiropractor's office, they can write an order for you to get an x-ray, correct? Mm-hmm. And you can get it done immediately. If you're a veteran that's eligible at the VA, and you come to a VA community care provider, if you don't go to the VA, if you don't go to the VA ER for that visit, you quit, or you don't go to a big hospital like a BJC or something like that, you don't get that x-ray. We have to wait on primary care to approve that x-ray. And sometimes it takes months. We have cut the red tape. We have provided this partnership with Metro Imaging, where we take it on our nonprofit side because we need to treat that patient immediately. If that patient is coming in with back pain, if that patient is coming in with leg pain and they've fallen, that's cut. They've given us a special discount. So that's a charity fee right there. We also provide transportation to and from the visits. That's a big thing within the VA system. We were just donated 2 vans by Metro because we have veterans that come up there. We have a lot of veterans that visit our facility, and they love it, and they see the disparities, especially the ones that live in the low socioeconomic backgrounds. We also, we kind of take a stress off of them. At one point, it was 22 veterans commit suicide. But these programs these groups that we're having, these art therapy programs that we're doing, we're cutting the opioid crisis, and we're also cutting down on the mental stability of wanting to commit suicide. And it's working. We went as far as Breezy, Illinois, to pick up a patient who we hadn't heard from, and he said, I need to be picked up. I miss you all, and I'm not in a good space. And that patient has now gotten into the St. Patrick Center, has his own apartment at the Freedom Place Center now. Brianna just got him a bike. He's living the city life now, and he's not on the edge. So, again, that 250 does that. We even house veterans. We have resources. We work with landlords who primarily don't want to rent to veterans, and we pay the first and last month rent. I go to partners like a Jim Onder or whoever I can go to ask for money or do a fundraiser. So I feel like it's time. We've been out there.
With regard to the medical services that are provided, it doesn't sound like you have a dedicated list of providers that are on staff fully.
We do.
So, you do have dedicated
We do.
providers. Are a good number of them, though, coming in from other practices to help
No.
you? So you have your own team.
I got my own team. I've always started out with my own team. My medical director is Dr. Valerie Walker. She was the first female. She was over the state of Missouri medical board. She was appointed by Governor Carnahan, and she is known for preventative care. Her father was a veteran, and she's dedicated herself to VAUC. We have a neurological doctor, Dr. Joseph Yazdi.
Mm-hmm.
We have a chiropractor, an acupuncturist, Dr. Charles Quiglis. We have another chiropractor, Dr. Matt Myers. We have Mr. William Johnson that's leading our program for mental health. And we also have patient education, health education, and benefit assistance, Dr. Leroy Scott.
Good. Do you have any idea off the top of your head what your operating budget is to date?
On a monthly, I can tell you, because some things just went up last month. On a monthly, I'm at about 30 a month with everything as of last month.
30, when else do you hit on
30,000.
that? Okay.
Yes.
Okay, very good. And is that consistent?
That's consistent.
Okay,
Yes.
very good. All righty. Any other questions before? Yes. Senator Nicola.
Yeah, thank you so much for what you're doing for veterans. I appreciate that.
Thank you.
I know where you're at and what you're saying and finances and all of that, but do you have any long-term plans on coming to Kansas City? That's where I'm from.
So yes, so I have been working. I actually been working with Congressman Mike Boss. I've been up in D.C. For about a year now. Congressman Boss, he really pushed forward for me to get my contract because I couldn't, because I opened kind of during that COVID era. And him and I have been talking. He put me with an organizational development team, and Dayton, Ohio has reached out to me. Memphis, the city of Memphis, the mayor. Also, I would love Kansas City. I love Kansas City. I just came back from Kansas City. And Las Vegas. So Henderson, I just met with the mayor of Henderson. So yes, I hope in the future to pop these clinics up and these wraparound services all around the U.S. As I said, I'm working with a team, and it has to start here, though, because I'm from Missouri.
Sure.
And I love St. Louis. I moved back from Atlanta. I was an Atlanta VA Medical Center worker. And I quickly identified that we can't take care of these patients. They're calling in. They're crying. Some of them have cancer. I led the mammography team, and I couldn't get the consult out fast enough. So just think, if my clinic was there, they can come in and get out. So I plan on taking over the second floor in my building. If there's some sort of appropriation I can get, we want to expand services. I have an OBGYN right now that wants to come and work with me. We have different specialties that want to come. We have a podiatrist that just coming off of surgery, and he's amazing, and he's cutting down on the diabetic foot care, the ulcers, and he's flying in next month, and he's from St. Louis. So this is how important the mission is. And because we carry ourselves in such a manner and take care of veterans, they're coming. These specialists are coming. And State Representative Stephanie Boykin, she said anyone can come to her, and she doesn't have a problem saying anything about VAUC. She is our patient. And I would love to come to KC.
Yeah, great. Thank you. Appreciate it.
What it has now currently? Oh, my ask is 250. If there's anywhere you guys can just squeeze it out. Just anywhere. We need it.
Excuse me, I'm curious, after hearing your substantially lower treatment costs, do you have opposition from other providers?
No.
Okay.
No.
Very good.
No, I think when you work in healthcare, if you're truly there to do the work of God, and you're truly there to take care of veterans and patients, I think sometimes the money that's being paid, I don't think that comes into play sometimes. We also keep a clinic where the numbers aren't very high, because I'm not a FCQH, which not the numbers aren't high coming through the door, but the numbers aren't high for the providers, and that's why I continue to add on providers so they won't be burnt out. I don't want my providers burnt out, or the staff. I want on one side for veterans to get quality care. I want my provider to be able to go old school and speak to you and talk to you and tell you what this looks like. And you might have been somewhere else, and yes, this is an urgent emergent care clinic, but let us help you. And even though you're not eligible, keep coming back so we can help you and we can cure you. And I want veterans to feel like they can see providers and they're not just a number, because in America right now, in the current state, we're fighting for everything else. But I think it's very sophisticated to say we care about veterans, a lot of Americans, but I don't see the sophistication there. I don't see the healthcare there. And so we're bringing something new. And so my providers are all in, and they know if they're not, they can't work at my facility.
Well, from what I've heard, it sounds like you're taking something that appears to be complicated to a simplistic model, and it appears to be working too. Brianna Garza, do you have any additional comments you'd like to make?
Thank you, Senator. So Ms. Nicole really covered pretty much everything of the entire company. One thing that I can speak on is that when I was seeking help, it just felt like I could breathe once I walked into the clinic. And I'm not just saying that because I work there. I truly, it's helped me so much. I just recently got back from the Southwest Border Mission, and that was back in December, and I was counting down the days until I could come back to work for Miss Nicole, because she just appreciates me so much and everything that I have done so far, and I've only been there just a few months, and she's guided me through not only my career and where I want to go, but also just in life in so many ways.
Very good. Any questions or comments for Brianna? All right.
So back to Kansas City. Do you have any idea, like if you were to open up a clinic in Kansas City, just the initial cost that would be?
Yeah, so if we do a small scale, I just did a cost for Dayton, Ohio, and the building is 3,500 square feet. And we were looking at, I think, with just having some cush money for payroll and things like that, I think we were looking at, I think we said on a low scale, it was like 400 or 500. Yeah, and that's with everything. And that's covering a first year, close to a first year of payroll. We've also become a teaching institute also, so we can cut down that way. I sit on the board of St. Louis College of Health Careers, so we have medical assistants come in. And so I would do the same thing in every market. We also we were just approved for the federal program where we have those deployed veterans come in as well who want to go into healthcare.
Okay.
So, yeah.
So roughly $500,000
About a
to
half.
get you started.
Yes.
First year payroll.
Yes.
Okay.
Yep.
Appreciate that. Thank you.
Yes.
Well, Ms. Jenkins and Garza, thank you for your testimony, and we will take this and run with it a little bit and perhaps give you some information as we go. And we may need for you to fill in some of the gaps as we have questions that we can't answer, but I'm sure you'd be willing to do that. And I'm grateful for the work you're doing, and it sounds like your vision is something that needs to catch fire, and I think hopefully you'll light that spark.
We just need the push. She started off with how many patients in your peer-led
In my
group?
in my support group, I started that. I think it was early February. Nobody showed up to the first class. A little bit of a bummer, but I knew it just needed time to grow. Within 4 weeks, I finished with 15 patients in my class. And we
15 or 50?
15.
15,
Yes.
okay, very good.
So much so
That's
that
big.
I want to open up a second group, and I don't just bring them together and just talk about whatever. Like, no, we have topics each week. I make slideshows, and I really go into depth of some of the topics that not a lot of people cover, or some that aren't really comfortable talking about.
Sounds like your mentors rubbed off on you a little bit. That's good. Glad to hear. Well, thank you for taking time. Any final comments before we've got some time. We're waiting on one member, and he's here. So,
Well, I think, Senator, we and committee, I know it seems kind of, I'll tell this story and it's funny. J. Ashcroft walked into my office and he was sent there. And he told me, you need to become the pipeline to the VA. And I
yeah,
felt
I'll
that.
let her finish real quick.
And he said, you're crazy. And I said, why? And he said, you are taking on all these patients. A 30-minute, he probably was going to say no longer than 30 minutes. He stayed for 2 hours.
Okay.
And he saw how we flowed
Yeah.
and what we did. And he said, you got to get some money. You're doing well. And I said, listen, I know everybody doesn't understand this.
Right.
And they don't understand because it's the first in the United States. It was very important to make history. We made history here in the state of Missouri. But this is a force to be reckoned with.
Yeah.
And I want the state of Missouri to give us something and let us blow it up all
You
over.
bet. Sounds like a great way to be a beacon on a hill. I'm glad that you're at the forefront. Thank you both for
Thank
participating today and giving us information. We'll follow up and get more involved. So thank you very much.
Thank you.
It looks like we have now enough to make a quorum. So, Mr. Secretary, please call the roll.
Senators Moon,
Here.
Yes.
Bratton, Nicola, Beck, Lichtmeyer. Quorum established.
And with no further business coming before the committee, we'll make a motion to adjourn. Do I have a second? You got a second? We are adjourned.
Thank you.